Hello everyone, myself Dr. Aditya Gupta. Welcome back to one PYQ per day keeps FOMO away. कल मैंने Instagram और अपने YouTube short में एक simple question पूछा. I had asked a simple question that a child with chloroma child comes to you with casualty. What is the next best step? Now this is the thing that examiner wants to ask you. First, there's an adult. It can be a child, it can be an adult. That doesn't really matter. He's coming to you in emergency. He's coming to you with chloroma. What is a chloroma? It's basically a soft tissue proliferation. Or they can also give you a scenario, the child is coming to you or the adult is coming to you with anemia. Anemia, how will they say that it's coming with anemia? They will give you a low hemoglobin value, or they will tell you the patient is having fatigue. The child is coming with fever. The child is coming with bleeding manifestation, mucosal bleeds, gum bleeds, all showing that the hemoglobin is low, the TLC is either low, the neutrophils are low, there are a lot of infections, the platelets are low, along with either hepatosplenomegaly or not. This is what is known as a classical presentation of acute leukemia. In acute leukemia, you will have anemia, thrombocytopenia. Both of these things will result in bleeding manifestation, fatigue, generalized pallor. Fever will be there because of the disease itself or because the neutrophils have gone down and that is contributing to an infection. At the same point of time, there might be hepatosplenomegaly. Sometimes hepatosplenomegaly is not there. Or this acute leukemia can also present an extramedullary presentation in the form of chloroma, in the form of soft tissue proliferation, which is common in AML M2. Now they are asking emergency mein aaya hai. The reason AIMS keeps on asking this question is because most of the patients come to AIM in emergency first. They don't get to the OPD. They come from Bihar, they come from Uttar Pradesh, they come to Delhi at 6 o'clock, 7 o'clock in the evening, and at 9 o'clock in the night they come to you in emergency. They can come with this set of symptoms or they can come with chloroma and any other thing, a presentation of acute leukemia. What is the next best step? Listen to this very carefully. At 12 o'clock in the midnight, can you do bone marrow? Will you do a bone marrow? At 12 o'clock in the midnight, can you do flow cytometry? No, right? But can you do a peripheral smear? Yes. A peripheral smear takes exactly 1 hour. 1 hour for staining the slide and after that 5 minutes for reviewing the slide. And that can immediately tell you whether blasts are present in the peripheral blood or not. So the child has or the adult has come to you with chloroma. So you want to confirm whether the AML is there. And if you want to confirm whether AML is there or not, you can simply look at the peripheral smear and that peripheral smear can tell you whether blast or not. Later you can to confirm the diagnosis. To confirm the diagnosis, you can go for bone marrow and flow cytometry and stuff like that. But in emergency, the next best step would always be a peripheral smear. So always see the language of the question, what the examiner is trying to ask you. He's giving you a scenario of an acute leukemia child or an adult. या तो क्लोरोमा हो सकता है या मैंने तुम्हें वो बताया अनीमिया थ्रोम्बोसाइटोपेनिया फीवर वाली प्रेजेंटेशन हो सकती है एंड देन ही इज आस्किंग यू इमरजेंसी में नेक्स्ट बेस्ट स्टेप क्या करोगे टू गेट टू द डायग्नोसिस ओके इट इज अक्यूट ल्यूकीमिया पीएस में ब्लास्ट दिख जाएंगे सिंपली यू कैन डू अ पेरिफेरल स्मीयर लेट्स से दे हैड ट्विस्टेड द क्वेश्चन अराउंड एंड दे हैव ट्विस्टेड द क्वेश्चन अराउंड समटाइम्स दे हैव आस्क्ड दिस tell what you will do for confirmation of diagnosis. Can PS confirm the diagnosis? No, because PS will simply show blast hai ya nahi, whether blast are present or not. It cannot tell you whether they are leukemoid blast, whether they are lymphoid blast or they are myeloid blast. For that you need flow cytometry. Because ALL will have CD19, CD10 positive blast, while AML will have MPO positive blast. In order to know whether this is MPO positive or CD19 or CD10 positive, you need flow cytometry. You need to do flow cytometry. So for confirmation of diagnosis, the best test is flow cytometry. Now flow cytometry can be done on peripheral blood as well. It can be done on bone marrow aspirate as well. The better sample is considered bone marrow aspirate. The best answer for confirmation of diagnosis is flow cytometry. If flow cytometry is not given, then to confirm the diagnosis, we can do bone marrow because bone marrow will show more than 20% blast, the WHO definition of acute leukemia. Now I'll revisit the concept. A child is coming to you in casualty, क्लोरोमा हो सकता है या वो प्रेजेंटेशन हो सकती है. नेक्स्ट बेस्ट स्टेप, अभी तुम्हें बस देखना है whether the PS, whether there are blasts or not, whether you want to know whether it's acute leukemia or not. If you just want to know whether it's acute leukemia or not, because aplastic can also have that presentation, you just need the PS to see whether blasts are there or not. So the next best step in casualty would be PS. If you want to confirm, now you know it's acute leukemia. Now this acute leukemia can be ALL or it can be AML in both children and adults. For that we need CD10, CD19, we need MPO. These are flow cytometry markers. So the confirmation of diagnosis will be done with the help of flow cytometry. Now flow cytometry is a technique. The sample can either be a bone marrow aspirate or it can be a peripheral blood. If flow cytometry is not given, bone marrow aspirate becomes a better option because it shows more than 20% blast. Another common scenario they keep on asking your exam is adult, 6 months, 1 year history. So it is showing it's a chronic case. It's not an acute case. Chronic case. Comes to you with splenomegaly, huge spleen, TLC of 1 lakh. So we know this is an example of chronic leukemia. And most commonly chronic leukemia with huge splenomegaly is nothing but CML. This is a very common presentation asked multiple times. Now then they ask you what is the next best step. The next best step always will be peripheral smear. Remember, the next best step will always be a peripheral smear because in casualty you really won't do a bone marrow aspirate. You'll just go and do a next best step. Why do you want to do a peripheral smear in chronic leukemia? Because you want to see whether it has transformed into blast crisis or not. Where you can see the entire range of maturation of metamyelocyte, myelocytes, band forms and stuff like that. So next best step will stay peripheral smear. But how do you confirm the diagnosis? Do you confirm CML with flow cytometry? No. Flow cytometry is for acute leukemia. For CML confirmation, we want to see what? We want to see 922. We want to see this very famous 922 Philadelphia chromosome. And how do you see this 922 Philadelphia chromosome? We do an RT-PCR. RT-PCR is best because in 5 to 10% of the cases there are cryptic mutations, so FISH cannot detect that. So RT-PCR is the better option if FISH is also given. If RT-PCR is not given in the choices, then choose FISH. Then FISH will be able to detect that, the translocation of 9 to translocation 922, FISH will be able to detect. Sometimes that translocation is cryptic, that's why FISH is not able to detect. So that's why the best thing to diagnose is always RT-PCR. In our institute, we always use RT-PCR. But if RT-PCR is not in the option, the examiner is not giving you the option, then choose FISH. Okay, I hope I have tried to cover 3 important questions here in which children always tend to get confused. First is next best step in emergency. This will always be peripheral smear. If an acute leukemia is coming, you want to see whether it's acute leukemia, aplastic or other causes of anemia and thrombocytopenia. A simple smear with blast will tell you whether it is acute leukemia or not. So next best step will always be peripheral smear. Acute leukemia confirmation of diagnosis, you do flow cytometry. For the confirmation of diagnosis, you do flow cytometry. Now this flow cytometry can be done on 2 samples. It can be done on bone marrow, or it can be done on peripheral blood. It can be done on both of them. Bone marrow is the better choice because definition says 20% blast in bone marrow. So bone marrow is better out of this. Next, CML. CML, that we don't want flow cytometry. We want to confirm whether it is 922. Now this 922 detection is done best with the help of RT-PCR. It's best done with the help of RT-PCR. It detects in almost 100% cases. 85% cases FISH also detects, so RT-PCR is a better option as compared to FISH. If RT-PCR is not given, choose FISH. Hopefully you have understood the concept, the next best step, confirmation of diagnosis and differentiating it from CML. That's it from my side today. Thank you and have a nice day.